Good afternoon. I'm Adrian Dix, BC Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for BC for Monday, June the 29th. Tomorrow at 3 o'clock we'll be releasing a written statement with case counts. July 1st there'll be no statement. July 2nd, Dr. Henry and I will be in Vancouver to give a briefing, and on Friday there'll be a statement. We will be here tomorrow at noon to discuss some issues around visiting in long-term care. So we'll be having a discussion and a briefing at that time. I'm honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations, and it's my honor to introduce Dr. Bonnie Henry.
Thank you very much and good afternoon. So today we are reporting on 3 reporting periods since Friday. And between Friday and Saturday, we had 10 new people test positive for COVID-19 in British Columbia. From Saturday to Sunday, an additional 14 people tested positive. And then over the past day, we had an additional 2 people test positive, giving us 26 new test positive cases since Friday, bringing our total in British Columbia to 2,904 people with COVID-19. That includes 979 people in the Vancouver Coastal Health Region, 1,529 in the Fraser Health Region, 131 people in Vancouver Island Health Region, 200 people in Interior Health, and 65 people in Northern Health. We have no new health care related outbreaks, leaving us 6 active outbreaks now, 5 in long-term care and 1 in acute care. We have had additional residents test positive for COVID-19 over the past 3 days, bringing our total to 386 residents of long-term care and 229 staff people who have tested positive. We have had 1 new exposure event, which was released on the weekend at Brandy's Exotic Show Lounge in the Vancouver Coastal Health Region. Public health teams are actively contact tracing, and several close contacts are in isolation. There were 3 individuals who tested positive related to that exposure event, and because we have not been able to directly contact all of the people who might have been at Brandy's, public notification was put out on the weekend. So anybody who was at the premises the late night on June 21st, 22nd, 23rd, and 24th between 9 p.m. and 3 a.m. may have been exposed and are asked to monitor themselves closely for symptoms. We are at a point now where people are in the incubation period, may start showing symptoms of this virus, and they need to contact 811 or call local public health immediately so that testing can be arranged. The other outbreak that we've had recently, one of the other ones, the Beresford Warming Centre, has now been declared over with no additional cases. And we continue to monitor and support at remaining community locations. So that leaves us with 153 active cases here in British Columbia, of whom 18 are now in hospital and 5 people in critical care or ICU. We have had no new deaths since Friday, and we now have 2,577 people who have fully recovered. As we move into this phase of our restart plan, we must remember that COVID-19 remains a risk for everyone. Even though our new cases are low, we need to keep it there. As we gradually transition, we need to remain vigilant. We need to remember that we need to minimize, we need to manage the number of the cases that we do have, and we need to modify our activities to make sure we're not putting our community at risk. A key part of our efforts to contain the spread is for all of us to support these contact tracing efforts, and by keeping our numbers of contacts, our bubbles, small, and by paying attention to where we go and who we are seeing. It is a team effort that we need to continue together in BC. In this most recent exposure event, public health teams issued a public alert because we were not able to reach all of those who were in the premises and may be at risk. One slip is all we need to cause a significant rebound, and we have seen that happen in jurisdictions around us. and that is something we have all been working hard to avoid. We have established clear rules for our safe social interactions that apply to everyone. These foundational rules allow us to increase our time with others, to restart many businesses, and most importantly, to stay safe while doing that. We have flattened our curve here in BC, and to be successful and weather this storm, everyone needs to continue to do their part, whether we're at home, at work, or traveling. And we want to be absolutely clear. We can't afford to have exceptions or half measures. Businesses need to be aware that you are responsible for keeping your employees and your patrons safe, and you could be liable if appropriate precautions are not taken to protect people when they're in your work. Visitors from other parts of Canada or even within the province, you need to stay home if you're not well, and don't come if you're not well. Those are things that are important for all of us so that we're not having events that expose people, particularly people who are more susceptible to severe illness or death from COVID-19. This is part of our respectful travel and part of our travel manners that we all need to follow, whether it's in BC or whether we're going elsewhere in Canada. Now is not the time to travel with any symptoms of COVID-19. So as Phase 3 allows for more types of activities, how we interact with each other doesn't change. No matter what your summer plans may entail and where you go, where you're from, be respectful of others by doing your part. We have to remember when this virus is anywhere, the risk is everywhere. The risk is to all of us. So let's continue to show that kindness and respect that have gotten us this far in this province and remain 100% committed to our efforts to stop this virus here. And we also need to remember, of course, to continue to be kind and to be calm and to be safe. Thank you.
Thank you, Dr. Henry. I of course, we're always pleased when we can announce over the past 3 days that no one has passed away due to COVID-19 in BC. And we do reflect and remember those who have, however, and continue to keep their family members and the ones close to them in our hearts. As Dr. Henry has said, there are 18 people in acute care hospitals dealing with COVID-19 right now. That's 11 in Fraser Health and 7 in Vancouver Coastal Health, 5 in critical care. That's down, I believe, from 7 on Friday. Just a couple of small things in terms of healthcare system utilization. I've noted that in the past 3 weeks, we're back to normal in terms of the number of surgeries that are performed in BC in a week. It's been between 6,100 and 6,500 surgeries a week for the last 3 weeks, which is impressive. I'd also note that on June 26, which was Friday, we had 5,869 emergency room visits in BC, and that 5,869 is the highest number since March the 9th. So clearly, our hospitals are again, they've been busy all along, but are again dealing with very significant number of cases in the emergency room and doing enormous and extraordinary work with respect to surgeries, and express appreciation to everyone who's doing that work. I wanted to bring everyone up to date on our PPE, as we do once a week. As with previous weeks, I'll report on how much PPE has arrived cumulatively since the end of March, and then specifically what has arrived over the last week. To recap the cumulative totals that go up to Tuesday, the 22nd of June, the following PPE has arrived in BC in that time. Just over 5,719,000 N95 or equivalent respirators, almost 20 million surgical or procedure masks, just over 2,300,000 pieces of eye protections, including goggles and face shields, over 46,800,000 pairs of gloves, over 2,760,000 gowns. Many of the items I've just listed are in our testing process to make sure product meet or exceeds safety requirements before being used in BC's healthcare system. Today I can tell you that over the last week, since the last update on June the 22nd until yesterday, we've received the following in the last week, in addition to the numbers I just read: 214,920 N95 or equivalent respirators, 2,346,454 surgical or procedure masks, 1,864 pieces of eye protection, 2,834,300 pairs of gloves, and 65,035 gowns. We'll continue to source and test our PPE and are working hard to pursue any and all credible leads for safe and effective product for our healthcare system and for our workers. I wanted to join Dr. Henry in her comments of saying that this phase 3, the continuing importance of physical distancing is essential to our collective efforts. The continuing importance of staying home when you're sick are important to our collective efforts to flatten the curve and to stop the transmission of COVID-19. Our efforts have allowed us to proceed further with our economic renewal. Through our efforts, more businesses and industries are able to participate in our recovery. And with us now able to travel in BC to communities that welcome us, we've expanded our ability to play a greater role in the recovery too. In the days and weeks and months ahead, we need to remember this. While BC travel is a welcome break from the local places we know, it is not a holiday from the skills we've been taught to stop the spread. In fact, as we travel to new places and those we've not seen for a while, we need to be even more dedicated to the actions we've been taking to stop the spread of COVID-19. Wherever our COVID BC journeys take us this Canada Day week and over the summer, physical distancing must always be our closest companion. Physical distancing saves lives. I think this is important to remember, including in the discussion, whether you are traveling on an airplane from Toronto or anywhere else, that physical distancing remains essential and important to our efforts. And it'll be our expectation, as we are doing in BC and as we are doing in provincial jurisdiction, that the federal government will do the same in terms of ensuring that people are safe and are employing physical distancing as required, especially in places where they're together for a long time, such as airplanes. In this pandemic summer, we've got to continue to stay 100% all in, stopping the spread and helping others stop the spread while they explore our communities and our province. This will be the most important summer memory we can create. In our Canada Day celebrations and beyond, let us continue to stand together by staying apart. Let us continue to stand on guard against the spread of COVID-19. Quelques mots en français. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune, soit celle des 26 et 27 juin, celle de 27 juin et 28 juin, et celle de 28 juin jusqu'au 29 juin en mi-journée. Il n'y a eu aucun nouveau décès lié au COVID-19 durant ces 3 périodes de référence, pour un total de 174 décès en Colombie-Britannique. Nous continuons à offrir nos condoléances à tous ceux qui ont perdu leurs proches pendant cette pandémie. À ce jour, 2577 personnes dont le test de dépistage de COVID-19 était positif sont maintenant rétablies. Pour la première période de référence, qui s'étend jusqu'au 27 juin, nous avons eu 10 nouveaux cas. Pour la deuxième période de référence, qui s'étend jusqu'au 28 juin, nous avons eu 14 nouveaux cas. Au cours des dernières 24 heures, 2 nouveaux cas se sont ajoutés. Cela représente 26 nouveaux cas depuis notre dernière mise à jour vendredi, pour un total de 2904 cas en Colombie-Britannique. Et thank you very much, and we're happy to take your questions.
Thank you, Minister. As a reminder, on the phone, please press star 1 to enter the queue. If you have already pressed star 1, please re-enter it. Please unmute your phones. You will not be audible until I call your name. As a reminder, you are limited to 1 question and 1 follow-up. First question today is from Binder Sajan, CTV.
Hi there. Just wanted to follow up on what you said. Hi. Just wanted to follow up on what you said there about the airlines. Dr. Henry, can you tell us about how big of a concern this is that airlines are relaxing social distancing rules, and what advice you have for people who may be considering a flight?
Yes, as we know, the rules for air transport come under Transport Canada and the international rules as well. So, we are concerned. It is an environment that we know people spend a lot of time in close contact with each other. There are measures in place on airlines, including the way that the circulation of air happens. Certainly, it is incredibly important to be wearing a mask, but we also feel that physical distancing is an important part of that as well. I know that Transport Canada will be working in the airlines to make sure that everybody is safe, but I think the other really, really important thing that we need to remember is you should not be traveling if you are ill. And we need to have screening processes in place that identify people before they get on board an aircraft, and that's what keeps other people safe as well. And I can say that has we've had occasion where in the past week where people have arrived with symptoms and have tested positive for COVID-19. So it is an environment where we need people to be honest about what they're when they're answering the symptom questions, and we need to make sure that we can screen people out from arriving in Canada, in BC, and other parts of this country with COVID-19. Did you want to?
Just to say that it is the responsibility of Transport Canada and the federal government to ensure that rules are followed and rules are applied here. And it is absolutely important that screening take place before people get on planes, whether it's from Toronto to Vancouver or Halifax to Toronto or wherever it is in Canada. And that obligation has to be fundamental. It can't be just one of those things that becomes quicker and quicker throughout the summer as we need to get people moving. It is fundamental to stopping the spread of COVID-19. And that's a responsibility that Transport Canada and Health Canada and everyone else needs to work on with the airlines. With respect to the change in the rules and the increase in the number of people in a given airline, what we want to hear, what I'd like to hear from Transport Canada, what I'd like to hear from Health Canada is, do they agree with this? Because it is absolutely within their jurisdiction to deal with. So if what they're saying is what Air Canada and WestJet is doing is acceptable to them, they need to be explicit and they need to explain why it is. And that's what we'll be waiting to hear. In the meantime, we all have to take our own responsibilities seriously. We cannot travel when sick. The consequences for other people are significant. And this is, as I say, fundamental, not just to stopping the transmission of COVID, BC and British Columbia, but in every province, and all our friends in other provinces and people across Canada. So that's my expectation. My expectation is to hear explicitly what the position of the federal government is with respect to physical distancing and whether they agree with those decisions, because it's exactly within their jurisdiction to decide, and I'm hopeful they'll lay that out, either to allay fears or to at least express what the thinking is at the federal level. In the meantime, we just have to continue our efforts, because physical distancing saves lives. Dr. Henry has said it. I've said it many times. Medical health officers said it. We know it's true, and we saw it in the results. We saw it in the federal modeling today that was presented in Ottawa. And so that has to, I think, continue to be our focus in the coming weeks and months.
Do you have a follow-up, Binder?
I'm good, thank you.
Thanks. Next question is from Richard Zisman, Global News. Richard, are you there?
Companies.
Oh, can you start again, Richard, please?
Yep. We're hearing concerns from catering companies, Dr. Henry, about the guidelines severely impacting their businesses. Two of the largest companies in Vancouver have already declared bankruptcy due to the pandemic. Are you considering any measures when it comes to catering that would allow them to fall under the same regulations as restaurants or nightclubs? The complaint from the owners is they're being held to the same standards as larger events like the PNE.
Yeah, they're being held to the same event standards that apply to pubs and restaurants, and they have to have restrictions if they're having an event. So it's a very different thing to think about people coming together as a group of 50 versus small tables. And remember that in restaurants, the restrictions are 6 people at most. And I know There's been concerns expressed to me from some restaurant owners that people are coming with a larger group and wanting to be accommodated together. The rationale for the distancing, the barriers that we have in restaurants and the smaller groups are not only for your protection as somebody who is there with your small group, but also for the protection of the employees. So it is, that is something that is not going to change. When we have events, we need small numbers of people. And when you're catering an event like a wedding, like a graduation, whatever it is, those are the settings where we know people get together, they exchange information, they have close contact with each other. So it is a different situation from a restaurant. It's also a different situation from these from pubs who are having events. So if they are having an event room, and it's very clear in the guidance that we've put out, it can be a maximum of 50 people. So those are not likely to change. These are what we need for now. And when we've seen around the world where this outbreaks happen, it's when you have larger numbers of people. So it's a bit of both. We talked about the need to be able to know who we're connected with, and the need for us to be able to facilitate the work of public health that we are doing every day and following up every single case and making sure we are able to connect with every person that they've come in contact with. So it makes it much, much more challenging if we have larger numbers.
Do you have a follow-up, Richard?
I do. And based on what we've seen at Brandy's, should there be stricter guidelines around strip clubs? Should they be characterized in the same place, the same way as we've seen clubs which have not been able to open? Are you concerned about that industry, considering what we saw last week?
So they were under the event license that would be applying, they were ostensibly operating under that same type of an event license that would apply to a pub or other food forward license. And so, yes, they were in some sense going around the regulations to be able to hold events, and they are closed down because the safety plan that was in place was not adequate. So yes, I think there are concerns, and they are skirting the rules in some ways. And this is where we have to realize that these aren't things that we're inventing to try and punish businesses or people. It's to try and ensure that we're not letting this virus get out of control. And we've seen it happen. We've seen it happen in Washington State, in Texas, in California, in Arizona. We've seen it happen in Europe, in Zurich. They had a very similar event where hundreds of people were not supposed to, but were in a nightclub together, and now they've had a takeoff in the virus. So these are the things that we need to do for this summer. This is going to be a challenging time for us, and I know for many businesses it's going to be a very challenging thing too.
Next question is from Christopher Folds, Kamloops This Week.
Hi. There's a petition up here at a seniors home, 140 strong, with the seniors going stir crazy, and they want restrictions to be lifted so that they can at least go and visit the park and walk along the Rivers Trail. They argue that there's neighbors who aren't in seniors' homes living right next to them who are able to come and go as they please. So they're wondering if there's any thought about lifting those restrictions to allow them to go out and enjoy the parks.
I know that each home has its own ability for people to come and go. The challenge with long-term care homes is that they're a collective accommodation site, and we know that what we do as an individual in those places affects others. So the risk of bringing a virus back into the home is something that we take very, very seriously. But we are looking at how to expand that in a safe way for people here in BC, and we'll be having more about that tomorrow.
Do you have a follow-up?
Nope, that's it. Thanks very much.
Thank you. Next question is from Tanya Fletcher, CBC.
Oh, hi, Dr. Henry. In light of how critical it is to have quick contact tracing, you'd mentioned, within 48 hours, almost finding everybody. So putting that through the lens of what happened at Brandy's, it's been a week since the first exposure. So how concerned are you that we could see a significant outbreak stem from there, given we haven't been able to trace all the contacts yet?
Yeah, and that's why we put out the public messaging so that anybody who was there can identify and get tested if they have any symptoms at all. And as we say, we're in that critical period. So it is absolutely, this is why we have those little things like taking a contact number for at least one person in the party in a restaurant or an event, so that it makes it easier for us to know who was there and who was potentially exposed, so that we can protect people. And yes, I am concerned. We have not yet seen transmission from this event, but it's very possible. We recently saw in Kingston, Ontario, where in a nail salon there was transmission. So, these are things that we need to take really seriously, and we need to all do our bit to make sure that we're not giving this virus a chance to spread widely, because that is going to affect our ability to keep doing what we're doing.
Do you have a follow-up, Tanya?
Just if we could get a comment on the Brandy's exposure case in French for my colleague, please, from Minister Dix. Thank you.
Juste pour dire que l'entreprise en question, Brandy's, n'a pas suivi des règlements et donc il y a des conséquences à cela. C'est fermé maintenant. Mais les conséquences pour le système et pour les gens peuvent être encore plus graves. Pour les gens qui n'étaient pas et qui n'iraient pas jamais à Brandy's, mais qui quand même peut devenir malade en conséquence. Donc, c'est sérieux ce qui s'est passé. C'est important que tout le monde qui était là pendant les périodes mentionnées par le Dr Henry doivent se reconnaître d'une maladie et aussi être prêts à être testés s'il y a des problèmes, des symptômes. Donc ça, c'est très important. Mais cela démontre la nécessité absolue de suivre des règlements qui n'étaient pas suivis dans ce cas. Et les conséquences pour les gens qui n'étaient pas là peuvent être très graves. C'est pas seulement ceux qui y sont allés, mais tout le monde qui peut payer les conséquences de ces actions. Donc c'est grave, c'est sérieux, et il faut que des gens prendre leur responsabilité maintenant de se montrer et de répondre s'il y a des problèmes ou s'il y a des symptômes.
Marcella Bernardo, News 1130.
Hello, everyone. Thank you for taking my question. I know you touched on this earlier about airlines no longer leaving middle seats empty starting on Wednesday. But Dr. Henry, for you, what is your comfort level with this happening when you just told us that people should be keeping their distance from each other regardless of whether they're sick or not? And for Minister Dix, you've been very vocal about this even today. Have you had any discussions with federal counterparts about your concerns regarding this happening?
So from my perspective, there's a number of different factors. So the risk really depends on numbers of people and how close we are, but the risk that somebody who has this disease is sitting next to you, essentially, because we know there's many other pieces that we have in place to try and protect people, including wearing masks. And we know that that is something that we need to do when we're in close contact where we can't maintain those safe distances. So I'm assuming, and I don't know all the details, but there's evidence to support this move. I know that's a fine balance right now for the airline industry, and so that's not my jurisdiction, unfortunately. I do think we need to be really, really careful about making sure we are being honest when we're being screened. And what part of that would be having flexible policies to allow people to delay or cancel flights if they're sick. Those are the types of measures that absolutely need to be in place if we're going to make sure, or if we're going to increase the numbers of people that are sitting next to each other in the aircraft.
Yes, I will be talking to federal counterparts about this question. I will be asking what I expect them to show, which is if there's evidence to show that this is safe or that the risks are acceptable. It's important to show that evidence. And it's important to also show, if you're Air Canada and WestJet, through all your other actions, your determination to stop the spread of COVID-19. You can't just talk about this in terms of its economic value to the airlines, although that's very important in our country. The safety of passengers and the safety of all people of BC, of Canada, and in BC in particular for us, is very important. So my expectation would be to hear from all of them as to how this decision was determined at the federal level, and what the evidence is that says that in this case, a reduction of physical distancing is acceptable. And remember, yes, it can be of value to wear masks, but that's only when there are no alternatives to physical distancing. And that masks do have a utility in that sense, but they're not an alternative to physical distancing. They're a way of keeping us all safer, especially not infecting other people if we happen to have COVID-19, to stop our own droplets from going out. So I think all of that is something I would expect the federal government to lay out, because the consequences of it, no one really cares what's federal jurisdiction or what's provincial jurisdiction. If people are sick or COVID-19 is transmitted, it affects people in BC, and that's of concern to me.
Do you have a follow-up, Marcella?
No, I don't. I don't think so. Thank you.
Thank you. Next question is from Brishti Basu, Victoria Buzz.
Hi, thanks. My question is for Minister Dix. It's about the racist guessing game that was disclosed a couple weeks ago. Minister, there are healthcare workers who now say that these guessing games involved patients of all races. In light of these reports, I'm wondering, will the investigation look into how the results of the games could have affected treatment for Indigenous patients specifically? And is there any indication that Indigenous patients were consistently assumed to be inebriated? And if yes, did treatment for them differ?
So just to update you, you should expect to see the terms of reference, which Mary-Ellen Turpel-Lafont is working on now, to be published this week. She's obviously been hard at work and developing her team and her approach to these issues. So it's my expectation that she'll do an excellent job in determining all of these questions, and that's what we've asked her to do. Regardless of the circumstances, such a game, should it have happened, and when the facts are established, is completely unacceptable and has very severe implications, especially for Indigenous people. And if it happened to other people, it would have implications for them as well. But it's a very serious matter, and that's why we've appointed an outstanding person, Mary-Ellen Turpel-Lafont, to review it. She'll be determining with us the terms of reference. We'll be publishing them this week, and that will lay out the terms of the inquiry.
Do you have a follow-up, Brishti?
Yes. Have the patients involved, allegedly, have they been contacted or offered any support?
So the purpose of the inquiry is to determine the facts of the matter and then to recommend appropriate actions once those facts are determined. The fact that we've acted as quickly as we did demonstrates the seriousness with which we take it. There also, seems to me, needs to be, we need to review those actions we are taking, some of them in our co-management in many cases of the system with the First Nations health authorities, some of which was demonstrated in the presentation by Dr. McDonald, Dr. Henry on Friday. We've got to see what actions we're taking now and what we can improve in the meantime to restore confidence in people whose confidence may well have been shaken by this discussion. So we've got actions that we need to take within health authorities and with the healthcare system in concert and working with, and at the leadership level, having Indigenous people at the leadership level of those discussions. And at the same time, we've got to determine facts, which is what Mary-Ellen Turpel-Lafont is going to do.
Next question is from Mary Brooks, West Shore Voice.
Hi, Dr. Henry. Some of the recent science is apparently showing a correlation between blood types and immune response to COVID-19, with like A and B blood types apparently more at risk than O type. Do you have any thoughts on that? And in terms of any sort of community immunity based on blood type that you know of so far?
Yeah, so it is interesting. It's preliminary. There's been a number of different factors that people are looking at, some of them genetic, like blood types, or some of them that are passed on. Also there's been quite a lot of looking at whether males are more susceptible to having severe illness or dying from COVID than women, and it's hard to pick out exactly one cause yet, but I think all of these factors are fascinating and really interesting. You may know that A and B and AB blood types are less common than O, which is the more common blood type, so it's not proven yet that these are related. This is a hypothesis generating study that was released, or at least the first part of it. So I think it's really, really interesting. It does not yet give us answers, but it can give us some indications that there's host factors that have to do with how well we respond to fighting off this virus. And it may actually be a convoluted path through the way that our immune systems work for different reasons. And we know that probably has something to do with things like the angiotensin converting enzyme, ACE2 enzymes in particular, and how our body responds to these insults of a viral infection. So I don't think there's anything conclusive yet, but we're certainly watching it. In terms of community immunity, or how much we have here in BC, it's still very low. We've been doing so well at stopping the spread that we don't expect to have huge numbers of people, or the percentage in the population. But having said that, even in places where they have had very severe infections, if we think of New York City, we think of Italy, we think of some of the areas that have had a huge first wave, the percent of people who are positive in the community is at most 10 to 14 to 15%. So we have avoided that. And the reality I think most of us are getting at around the world is that we will not have sufficient immunity from infection alone, and it's going to be a vaccine that is going to help us in terms of dealing with COVID-19.
Do you have a follow-up, Mary?
Yes, thank you. Has selection of people to participate in serology testing started from the public survey that you did in May?
Yeah, it's getting underway now. And I don't have the details on it. Some of the earlier studies, we should have some details later this week, I hope. But there is a process that has just started to notify people who've agreed to be part of the serology study. There's also a process that's underway, I think I mentioned this last week, nationally, to do a different type of blood spot test as well across the country, and that should be starting in the next couple of weeks as well. But I'll get more information on that later this week.
Next question is from Shannon Waters, BC Today.
Hi, Dr. Henry. I was wondering about what the province's testing capacity is currently at. I seem to remember, it seems like a very long time ago now, I think you said that we were up around the ability to process 7,000 to 7,500 tests per day, and I'm wondering if that has changed at this point.
Yeah, no, we're still about around 7,000 to 8,000 tests a day. We could ramp up to more than that if we needed to, and we are looking into going into the fall at ramping up to about twice that to 3 times that. So that's what the planning part of it is. Right now, we are testing about 1,500 to 2,000 people every day, and I think our percent positive is quite low. So that is reassuring to me that we are still doing a lot of testing of people who have symptoms or have been exposed, and that we're catching people that we need to catch. So we do have excess capacity right now, but we need to continue to build that up, and particularly ensure that our turnaround times remain less than 24 hours, which they are across the province right now.
Do you have a follow-up, Shannon?
Yes, please. Just wondering if you're anticipating, I know we're at a very broad point in testing now, but if you're anticipating making any changes to testing criteria, if that is possible at this point, given where we are in terms of social contacts and progressing into phase 3. And I don't know if you're able to speak a little bit about what that ramping up as we go into the fall would involve exactly.
Yeah, so no, our testing strategy, we're at the point right now where we're testing widely anybody who has any symptoms. And if you look on the BC CDC website, the testing criteria is there, and it's very, very broad. We also are testing people in circumstances where we know there's been close contact. So if you've in a household, some of the communal settings that we've seen, like long-term care homes or hospital settings, where we'll test everybody whether they have symptoms or not. And some of the other outbreak settings, we do that as well. So that's our plan to support our public health activities for the next month and into the fall. When I say ramping up, there's a couple of things. One is making sure we have the swabs and the reagents. So there's a lot of what they call consumables, different types of liquids that you need to do the tests. And some of them are cartridge tests, particularly some of the tests we're using in more rural and remote areas of the province. So we want to make sure we have that process up and running. We have enough of the reagents, the consumables, the swabs, all the pieces we need, and the testing machines that can be used in different parts of the province. So that is all being worked on right now, and it's a significant investment to try and make sure we have the ability, because as we've talked about before, it's not just COVID-19. As we go into respiratory season, we'll be looking for influenza in particular, and very much the same type of test is done and the same swab is used, RSV, parainfluenza, and some of the other things that cause people to be ill in our respiratory season.
We have time for one more question. For any reporters that didn't get to ask a question today, there will be a statement released later this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the Provincial Health Officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Keith Baldry, Global News.
Hi, Dr. Henry, Minister Dix. Thanks for taking my question. Back to the brandy situation. Given that this is an establishment that was skirting the rules, are you going to be stepping up, or public health step up, inspections of some of these venues, whether it's entertainment venues or restaurants? And could some of these closures ultimately be permanent?
That is absolutely what we're public health and WorkSafe BC, because these are, as you may recall, these plans are important protections for staff as well. So WorkSafe and the public health inspectors do have the ability to close places and make sure that they have an adequate plan. So they would not be able to reopen unless they do come up with a plan that meets the criteria that we've established for protection of both the employees and the patrons in those facilities or in those businesses.
Do you have a follow-up, Keith?
Yes, for Minister Dix, again, the weekly announcement of the PPE numbers always are very high numbers. I can't help but note the BC Nurses Union continues to run that ad that says a large number of their membership do not have access to PPE. So what's your response to this ongoing advertisement?
Well, I don't really have any response to the advertising. I just make the point that on, for example, N95 or equivalent respirators, 5,719,000 is a significant purchase. In addition to that, we added 214,000 more this week. That clearly the use of N95 respirators or equivalent as in the months of February and March grew dramatically, and that number has come down somewhat, although it's still obviously significantly higher than it was pre-COVID, and that we've been working with all our workers to make sure that the procedures for PPE are followed, and that's very important, and that we do all that we can to make sure that we have the PPE available now and into the fall. If we're considering, for example, expanding access to facilities, and that's one of the things we've been asked to do, ensuring that people remain protected in those facilities, whether they be acute care or long-term care, is very important. So we have guidelines, which obviously need to be followed. We have to get a lot of PPE, and we are. We've incorporated into our supply chains, much earlier than other jurisdictions, access to PPE for long-term care homes, whether they're private or public, long-term care homes, and that was very important. I think we've taken the steps. And I say equally that at the center of the heart of what we've been doing, because of the absolute respect we have for our healthcare workers, for our health sciences professionals, for our nurses, for our doctors, for those who clean hospitals, our decisions to reduce the number of people in hospital, our decisions to go out and get PPE in large numbers, our efforts to work together to use the PPE we have properly, all of this has fundamentally been about the safety of patients and about the safety of healthcare workers, including nurses. And we're going to continue to act that way, continue to work with people, because I think that is fundamental to our effort. When you reduce the number of people in hospital, we made that safer because we needed to prepare for COVID-19 and we needed to ensure that our healthcare workers and our patients were safe. And so those steps were taken. They were very difficult steps to take, but we took the steps we needed to take, and we took them together. So I think we're going to continue to do that, and we're going to continue this week, as we did this week, to source enormous amounts of PPE as we prepare for this summer and this fall and make sure that all of our healthcare workers have the equipment they need to be safe and to do their jobs properly. Thank you very much. Merci beaucoup. We'll see you tomorrow.
Thank you.